If you've been told that your child has hearing loss, you probably have questions. There are several different types and degrees of hearing loss, which means there are different ways to manage it, so it's important that you fully understand the type of hearing loss affecting your child. Learning which part of the auditory system is causing the hearing loss will help you understand how it affects your child's life and what can be done to maximize your child's potential to develop speech and language and to succeed in life. For starters, you might be asking how this happened. Hearing loss happens when there's a problem with one or more parts of the ear. Let's find out what goes wrong and how doctors can help. There are 3 parts to the ear: the outer ear, the middle ear, and the inner ear. Normally, the outer ear gathers sounds from the environment and funnels them through the ear canal to the middle ear. But sometimes, sounds cannot reach the inner ear. This happens when wax is in the ear canal, fluid is in the middle ear, or part of the ear doesn't form properly. Sounds will be muffled and very soft sounds will not be heard. This is called conductive hearing loss. This type of hearing loss can usually be fixed with medicine or surgery, like ear tubes that are placed in the ear. Another kind of hearing loss is called sensory neural hearing loss because it can include different types of hearing loss. Sensory, which happens when the cochlea doesn't work well or not at all. Neural, where the auditory nerve or other parts of the brain are affected, or even a combination of both. The cochlea plays an important role in hearing by amplifying soft sounds as well as separating all the different pitches or frequencies of sounds. It's like a piano, but with even more keys. The cochlea also sends messages about sounds to the brain by activating the auditory nerve. There are many different types of cells in the cochlea, but 2 are very important for hearing. The outer hair cells, which are responsible for amplification and frequency analysis of sounds, and the inner hair cells, which are the cells that communicate with the auditory nerve and ultimately the brain. If the outer hair cells aren't working well, or not at all, soft sounds cannot be heard and the discrimination or understanding of the frequencies of sounds is reduced. If the outer cells are affected, but the rest of the cochlea and the brain are working properly, the sensory neural hearing loss will be in the mild to moderate range. If inner hair cells are not functioning or did not develop properly, the severity of hearing loss depends on how many inner hair cells are not functioning. If none are functioning, then there is no connection between the cochlea and the brain. This means that no sound sensation is possible, and the child has a profound type of hearing loss. If some cells are functioning, but not all of them, the severity of hearing loss will depend on what is left intact in the cochlea. If there is a loss of both inner hair cells and outer hair cells, the connection with the brain is very disrupted, and if the sounds are not loud enough, very little information can be transmitted to the brain. Severe types of hearing loss will make sound recognition extremely difficult and speech understanding almost impossible. Some babies are born without an auditory nerve or with a small nerve, so your physician may order imaging, usually an MRI, of the inner ear and the brain after the diagnosis of hearing loss. Most cases of children with a small or absent nerve have this issue only on one side, which means that children can still hear from the other. In rare cases, both nerves might be absent. Your clinician may ask you if you want your child to have a genetic test done, as it can help specify the type of hearing loss and point to the appropriate type of management. Treatment for sensory neural hearing loss depends on where the problem is located. If your child has hearing loss due to a problem with the outer hair cells, fitting him or her with hearing aids may help. The hearing aids will basically do the job of the outer hair cells by amplifying sounds before they enter the ear canal, since the cochlea can no longer amplify the sounds naturally. If inner hair cells are absent or not functioning, a cochlear implant can be placed in the cochlea to restore, at least partially, the connection with the brain. After cochlear implantation, auditory verbal therapy will help with language development and communication skills. Diagnostic and behavioral tests can help to evaluate your child's type of hearing loss. Once you and your clinicians have a good idea of what is not functioning correctly, you can talk about the available options for your child. If your child has hearing loss, begin treatment as soon as possible. Kids who don't get treated early enough can have language delays and other problems. With the right care plan, your child will hear better and develop the communication skills needed to be successful in life.